Hi, my name is Dr. Chad Watkins with Watkins Foot and Ankle Clinic, and today I wanted to talk about bunions. So a bunion is essentially a bump on the inside of your big toe. And so often you'll have the bone sticking out and you'll get rubbing or irritation on the side of your foot. So what happens is there's some tendons and muscles on the inside of your big toe that pull your big toe over, and it causes your first metatarsal bone to swing outward. And so it's actually the head of the bone that basically is prominent and sticking out on the side of the foot. When it's a simple bunion, we can do surgery where we just shave the side of the bone and remove the bump. It's what people often call a bumpectomy or what we call a silver bunionectomy. As the bunion progresses and it gets bigger, we'll often have to do what we call a head procedure. And that's where we cut the head of the bone and shift it over into what we call the intermetatarsal space in order to get correction and straighten out the toe and remove the bump on the side. Now, as the bunion gets bigger and what we call the intermetatarsal angle gets bigger, we have to do the procedure further back on the foot. And so what you look at is when someone's got a really big bunion and basically the space in between the two bones, what we call the intermetatarsal angle, increases. You can't cut the head of the bone and put it where it needs to be and still basically have bone on bone contact in order for the bone to heal. So you have to have the bone sticking together. So you can shift the bone only so far and still have contact. If you shift it way over here, the head of the bone isn't connected to the shaft and it won't heal. So in that case, when someone's waited and their bunion has become very, very large, they have to do what we call a base procedure. And so what we do is we cut the bone back at the base and we swing it around. So we swing the whole head of the bone and the shaft around, and we do what we call a base procedure. And when we're dealing with a base procedure, often we have to put a plate and screws on in order to hold it in place. So with the simple bunion, we'll just shave the side. When we're dealing with the head procedure, we'll cut and shift the bone over and just put a couple of screws in, but you can walk on it almost right away. So the stitches come out at 2 weeks. You're back into a regular shoe at about 4 weeks, and then you're back doing strenuous activities between 6 to 8 weeks. It usually takes the bone 4 to 6 weeks to heal. When you do the base procedure, because of that angle becoming too big, you're off of the foot for 2 months in a cast, no weight whatsoever. Then you're in a walking cast, and then you get into a regular shoe at about the 3-month mark, and you get back to strenuous activities around 4 to 6 months. So it's a much more difficult recovery. So what I tell people is as long as the bunion isn't hurting you and it's not giving you any pain, well, you want to leave it alone. But once it does start giving you pain, once it does start giving you discomfort, then you want to do surgery sooner than later, because the bigger the bunion gets, the more difficult the surgery and the recovery is for the patient. Now, simple conservative measures are wider, deeper shoes, padding techniques, taking anti-inflammatories. If the nerve gets aggravated on the side, we can do cortisone injections. So there's all sorts of conservative measures that we can do to tread water or help you out until you're ready to do surgery. But once you're ready to do surgery, it's a matter of taking x-rays and seeing how big that angle is in order to determine whether you just need a simple surgery where you shave it, a medium surgery where you cut the head of the bone and do the head procedure, or the large surgery where you do the base procedure. So if you're having any bunions or any problems with the bunions and want to come in and talk to us, just give me a call at Watkins Foot and Ankle Clinic, 352 805-4317 in Leesburg, Florida. Thank you very much. Bye.